With this positive study showing a decreased infection using the Canopy ePro system, what we're really excited about, what we've been working about over the last year, is to roll this out to practices to allow them to use bispecific T-cell engager therapy. Now, this therapy we know has upfront toxicity, being cytokine release syndrome that requires very close monitoring and in some cases hospitalization during the step-up phase, but also the potential for neurologic toxicity. So this is, I don't want to use the term scared, but prevented a lot of practices from delving into this therapy because they just don't have the infrastructure. And our system, we believe, will really aid to that infrastructure. That in the previous study, we pinged the patient once a week. Now we can design it to send a message to the patient about specifically these symptoms every 4 or every 6 hours during that critical phase during the step-up portion of the study. If they answer, for example, they have a fever, which is almost always the hallmark symptom of cytokine release therapy, no other questions are asked. A button pops up on the screen that they can just push it, automatically connect to the practice. The nurse navigator sees this, it turns red in their queue, goes ahead of all the other kind of routine questions, and it allows the patient to get in very quickly. And we're seeing that this has been an effective way of allowing community practices to use this therapy safely and roll it out and actually help a lot of patients. The other thing is that after that first step up, usually a month, the patients, like the ones in the study, the big risk is infection because you're chronically lowering the immune system with these monoclonal treatments. So it changes, instead of every 6 hours, then it's maybe weekly or every 2 weeks, asking questions, reminding the patient that to call if they have even symptoms of a cold, that it can turn into something much worse. So we're super excited about that. And our next phase then would be to roll this out to CAR T therapy with the same thing, a lot of upfront toxicity, allowing it to begin as an outpatient with close monitoring, and all this in a very effective, efficient system.